Hello, this is Alexis May for AI Med, and today I'm delighted to be joined by Dr. Mike Roberts, Chief Medical Officer at Northland Health Board in New Zealand. Mike, welcome.
Hi Alexis, good to be here.
Great to have you here, Mike. Now, I've got to ask you first of all, New Zealand's response to the coronavirus pandemic has been held up as the epitome of best practice. Could you share a little of your experience over the last few months? How's it been for you?
Well, I think I should probably play down quite how brilliant our response has been just a little bit. We were very fortunate in that we were not affected until quite a lot of other countries had been, and we'd had the opportunity to learn from what they'd done and what had worked and what hadn't worked. So I guess in terms of our experience over here, we very definitely thought that we were going to be facing a situation where our hospitals were overwhelmed, and the fact that we ultimately weren't came as a huge and very welcome surprise. But notwithstanding that, we still got everything ready as though it was going to happen. And so I think probably that the biggest impact for people in New Zealand has been the almost complete suspension of all elective services while we prepared for COVID patients. And there was a lot of very quick rebuilding work in our hospitals to provide red and green areas, and huge changes to the way we staffed the hospital so that we were ready to have teams of people who could work exclusively with COVID patients. So I think we learned a lot from the planning. We did definitely learn a lot from other places. But the real impact has been for those patients with all the other problems other than COVID. And there's no question, over the last few weeks, we've seen a number of late presentations of cancer, and people who've, some even who've clearly had myocardial infarctions but have not come to hospital at the time they actually developed their symptoms. So a lot of mopping up to do.
And I mean, a lot of countries around the world are, now moving focus to, the journey back to, gosh, I don't know if business as usual is the right term. And as you say, we've got all the people waiting who are on list for elective surgery, and not to mention anybody who's presented or is now presenting with any particular symptoms. Now, what are the key challenges for you, and as you see them for hospitals in responding to this? And I suppose from the AI Med perspective, what are the ways that technology can help in dealing with that?
Sure. So I think the big challenge for us is making sure that from the very large pool of patients whose care has been deferred or delayed in some way, that we prioritize the people who most need urgent treatment now, to minimize the harm that's done. So I guess one of the things that a lot of people are talking about in New Zealand is the fact that many departments moved to doing a lot of telehealth consultations with their outpatient waiting list during the COVID shutdown. And that's something that we found was possible in a far shorter space of time than anybody had previously anticipated. And people had thought it would take a good while to get that sort of technology accepted, and that it possibly wouldn't be as useful as people hoped. But what we found was that it was very well accepted by staff, it was very well accepted by patients, and we've gone to considerable lengths to interview patients who had those sort of consultations, and we found out that certainly for follow-ups, they prefer the telehealth consultation than a face-to-face visit because of all the time and money that they save as a result. So we are investing heavily now in telehealth and making sure that we are developing sustainable models of video conferencing, telephone conferencing with patients. I think the other thing which is really important for us has been keeping track of the patients who have been deferred and we have a much more sophisticated data warehouse now that lets us understand exactly who's been referred by whom, with what sort of acuity, and there's been a lot of work in that area to make sure that we're prioritising people appropriately.
Okay, and so you don't see, I mean, we've seen an exponential, I think it's the word, sort of acceleration in telehealth and digital health solutions over the last few months. You don't see that sort of going back to how it was. You think this is here to stay?
I'm absolutely convinced of it. In amongst our general practitioners, we were one of the leaders in New Zealand in moving to digital health solutions for GPs, and about half of the practices in our area of New Zealand have been using telephone consultations over the last year or two. And as soon as we started to ramp up for COVID, we put all of the general practices on the same model, and they were up and running within 3 days. And none of them want to go back to what they had before.
That's really interesting, Mike. Thank you. Now, we're really pleased to have you joining us for a webinar trying to unpick some of these challenges on the road to recovery. That's taking place on Thursday, the 2nd of July at 9 AM UK time. Just to finish off our conversation here, Mike, what would you hope that people might take away from that webinar next week?
I think it should be a great opportunity for people who've been through this and perhaps dealt with it in different ways to share their experiences, and hopefully people will be able to learn from what's worked well for others and implement the same things.
Excellent. Thanks, Mike. We'll look forward to seeing you again then. That's it for today, but thank you so much for joining us. It's been great talking to you.
My pleasure.
And thanks to everyone for watching. You can find more information on the Road to Recovery webinar at ai-med.io.